visible. Can I get a quick thumbs up from everyone if my audio video is fine? Let me also check if everything is going smooth and there's no issue with the connection. So can I get a quick thumbs up from everyone if my audio video is all going smooth? Great. So let us discuss very quickly some of the important regulars. So welcome all of you. I'm Dr. Chesta Aggarwal, your Unacademy educator. Now on Unacademy we have a lot of offers and a lot of new features which we keep on introducing every day. Now the recent feature which we have introduced and that is a complete feature where you can battle and know where exactly you stand. This is only available on the Android app users. So those who are using Android, they can go and start using this feature. We have a lot of new batches which have already started and you can just go through them on the app. You can find them. We have also NEET PG 2023 preparation kit available, which is a 4-month subscription of 30,000 rupees only. You can use my code, that is Chesta10, to avail this offer. Use this code Chesta10. This is the price list, so whatever suits you, whatever plan suits you, you can just go and take it. Wherever they ask you for a code, use my code, and that is Chesta10. Now let us start with the discussion of the topic for today. I hope everybody knows me. I'm Dr. Chesta Aggarwal, your dermatology educator on Unacademy. In this session, we'll try to discuss a lot of old questions, which is one-liners, and like old is always gold, right? So the saying is always true. We get a lot of one-liners in recent exam patterns also. One-liners, if you know, you can answer. If you don't know, there's no way you can, guess, because not much information is given in the question. So for that, I've made this session. I'll try to discuss as much as possible one-liners here today. Now please tell me what is the correct answer. Investigation of choice for diagnosis of epidermolysis bullosa. Please read the question carefully. Everybody is answering it very quickly. Epidermolysis bullosa is a congenital condition. It is a mechanobullous disorder. So a mechanobullous disorder, it is because of gene defect, and because of gene defect, one of the protein of epidermis or dermis is missing. So will you see immunofluorescence positive? The answer is no, because DIF is only positive in the conditions where you have autoantibodies. But yes, in epidermolysis bullosa, there is no autoantibodies. The investigation of choice in these individuals is electron microscopy. Okay, it is not DIF, it is not sulfaficidin, and it is not a gluten-free diet. So the correct answer here is option number 2. Next question. Please tell me the correct answer of this question. The next question is on your computer screen. Inverted saucer shape lesion. I hope you know what is inverted saucer shape means. Just give me a second. Yes. When a plaque with sloping outer margin and perpendicular inner margin is present, something like this. You see it is sloping towards the outer margin and it is perpendicular on the inner margin. This is a very characteristic inverted saucer shape or punched out lesion, also very popularly known as Swiss cheese pattern. It's a classical feature of condition which is known as borderline tuberculosis or borderline. Please remember, it is mainly seen in BB. It gives you an idea that the lesion have started to progress. As we all know that whenever a disease progresses or whenever leprosy patient progresses, when the treatment is not given, there is a tendency for these patients to move from TT pole to lepromatous pole. The TT pole is a well localized stage From here it will progress to a diffuse stage. Okay, very nice, great. Is this point clear to all of you? Next, histioid leprosy is what is histioid leprosy? Histioid leprosy is it's a non-nodular diffuse form seen in the relapse of leprosy, facies leonina, or common in Central America. Histioid leprosy is a type of leprosy which is seen in the patients with relapse. Relapse could be because of drug resistance, which we used to see in the past when we used to give a monotherapy, or you can see them when the patient is a defaulter who stopped taking MDT. In both these cases, there is sudden increase in the number of Mycobacterium leprae, causing multiple asymptomatic nodules where the number varies from 5 to 50. It's a very classical variety. Can anybody tell me which is the non-nodular diffuse form? Anyone? Which is the non-nodular diffuse form? Histioid leprosy is a variety of leprosy. I would not say that it is a part of lepromatous leprosy. No, it's a different variant which occurs in a relapsed patient. Clinical presentation is completely different. Lepromatous leprosy is a sort of diffuse type of lesion, but histioid leprosy is more of a nodular type. Understood, Karthik? Great. So non-nodular diffuse form is actually anyone? Lucio. Non-nodular diffuse form is Lucio leprosy, which is very commonly seen in the Southern American states, that is Mexico. Here there is a diffuse infiltration. In histioid you see nodules, but in Lucio it is a non-nodular form, a diffuse infiltration of the skin which give it a very beautiful or shiny appearance. Clear? Next. What is the correct answer? Ridley-Joplin classification does not include indeterminate variety, does not include indeterminate leprosy. It is a type of leprosy seen in Indian classification system. Can you tell me there is one more type which is seen in Indian, not in Ridley-Joplin? What is that? There is one more variety or one more type. Indian classification has 5 varieties: tuberculoid, borderline, lepromatous, indeterminate, and there is one more which is known as pure neuritic. Pure neuritic. Okay. Next, Swiss cheese pattern of skin lesions. I have told you just now. We have discussed just now that the inverted saucer shape appearance of B.B. Hansen is also known as Swiss cheese pattern. So I am not giving you much time. This is a very easy question. Next. So too many of leprosy questions now. Which of the following is not a feature of lepra reaction? Which of the following is not a feature of lepra reaction? Which of the following is not a feature of lepra reaction? Please remember, whenever there is inflammation anywhere, there is increase in the ESR, not a decrease. There is increase in ESR, not decrease in the ESR. So that is a very important feature. Okay, that is a very, very important feature. Next. Can you tell me the answer about the next question? Please remember, a very important feature about leprosy control program is, in leprosy control program, for starting the treatment, we only need clinical diagnosis. We never prove leprosy on the basis of the histopathology or slit skin smear examination results. For starting or for instituting MDT, we just do a clinical diagnosis. So please remember, my students, the correct answer of this question is option number 4. You do not need any slit smear examination. The reactions, whether it is severe or mild, it do not require cessation of MDT, and thalidomide is used as a preferred drug. Please remember, although it is a good drug, but we prefer steroids over thalidomide because thalidomide has a very serious side effect of teratogenicity. Can you tell me what is that malformation? What is that congenital malformation which you see in the patients, those who are taking thalidomide? What is that malformation? It is phocomelia. Very nice, phocomelia. Next. TNF alpha is strongly associated with the pathogenesis of which of the following? Great, very nice. TNF alpha is one of the very important inflammatory mediator in erythema nodosum leprosum, which is nothing but type 2 lepra reaction. Can you tell me what is reversal reaction in leprosy? What is reversal reaction? Have you ever heard about this? What do you mean by reversal reaction? Anyone? Kunal, Kartik, Adil, Sai, Rohit, Aishwarya, Uma, Dr. Kunal. Anyone? Very nice, all my students. Please remember, reversal reaction is another name given to type 1 lepra reaction. Why it is known as reversal? Because see, we have 5 types on the basis of Reedley-Joplin: TT, BT, BB, BL and LL. And if you remember, I told you a few minutes back that there is a tendency of a patient to always move from TT pole to BT pole. Now what happens, especially in the borderline group, when you start the patient on MDT, there is sudden improvement in the immune status. So there is sudden improvement in the immune status and patient will start moving in a opposite direction, in a reverse direction of what is normally seen. And that is why type 1 lepra reaction is called as a reversal reaction. Did you understand or not? Because instead of going from the TT tuberculoid pole to lepromatous pole, because of instituting MDT, there is sudden improvement and the patient will start moving in a reverse direction. This is known as reversal reaction. First line anti-leprosy drug includes all except. First line anti-leprosy drug includes all except. Anyone? First line anti-leprosy drug includes all except. Very nice. Thiacetazone is not a first line drug. You give rifampicin, clofazimine, dapsone. What is the dose of rifampicin? Anyone? The rifampicin dose which we give is 450 mg. Is it correct? No. 450 mg is a dose for a kid, for a child. In adult, you give 600 mg. Clofazimine, the dose which we give is 300 mg. Both of them are per month and they are under supervision. You also give clofazimine 50 mg per day unsupervised. You give Dapsone 100 mg per day unsupervised. Clear all of you? Are these points clear to all my dear students? Great, very nice. One of the following is a side effect of using clofazimine. We have discussed a question, I think in the morning session, I don't remember exactly, but there was an image shown and I told you that there are 3 side effects of clofazimine. One was ichthyosis, one was intestinal obstruction, and there is one more. I hope you remember Prithvi, Rohit, Dr. N. Kumar, Uma. What is the correct answer? Very nice. Please remember the correct answer of this question is hyperpigmentation. They have a very characteristic pigmentation on their body. In fact, the nails can also show some changes compared to that of other conditions. Next question. In a patch of vitiligo, what do you see? I hope you remember that vitiligo is an autoimmune condition. It's an autoimmune condition. What is a vitiligo? It is an autoimmune condition where the T lymphocyte damage what? Melanocyte. It destroys the melanocyte in such a way that there is complete absence of melanocyte in the patch, and that is why it causes depigmentation. Clear? Next one. Which of the following is associated with Porphyria cutanea tarda? Which of the following is associated with Porphyria cutanea tarda? Anyone? Great. Please remember all of them. PCT is an acquired type of porphyria which occurs because of damage to the liver. Now, liver damage creates an inhibitor which goes and inhibit which enzyme? Can you tell me which is that enzyme which is inhibited in the patients of Porphyria cutanea tarda? It is urod. Uroporphyrinogen decarboxylase. So, whenever you have liver disease or damage to the liver, either secondary to infection, alcohol abuse, there is an inhibitor which is generated which goes and inhibit this enzyme, giving rise to Porphyria cutanea tarda. Pseudoporphyrins is due to, again this is a question from the same topic, very easy, not difficult, nothing much for me to explain. The answer to this question is all of the above. Sunbed, hemodialysate, photosensitive drugs, all of them, they produce pseudoporphyrins. Pseudoporphyrias are because of all of them. Now, why it is known as pseudoporphyrias? Because the clinical feature is very same. You will see presence of blisters on the sun exposed areas, but there is no heme synthesis defect, and that is why it is pseudoporphyria. They just mimic porphyria clinically. Pinch purpura is diagnostic of. Pinch purpura is a very classical term which is used for spontaneous abortion. Spontaneous purpura. Spontaneous purpura which occurs on the soft areas. For example, periocular skin. So spontaneous purpura which occurs in the soft areas, that is around the eyes or periocular skin. Pinch purpura. It is a diagnostic feature of what? Very nice, Brahma. What about Dr. Kunal, Ankit, Dr. Abita, Uma? Pinch purpura is diagnostic of. Great. This is a very classical feature of primary systemic amyloidosis. In a patient with multiple myeloma, what happens? In multiple myeloma, there is a protein which is known as Bence-Jones protein. It is the short chain of immunoglobulin which proliferates abnormally and they start infiltrating the organs. Along with the systemic or visceral organs, it also infiltrates the bone marrow. And whenever there is infiltration of bone marrow, there is pancytopenia. In pancytopenia, obviously the synthesis of platelet is reduced because there is thrombocytopenia, and when the platelet count goes down, patient presents to you with a very classical spontaneous purpuras on the soft areas like around the eyes. This pinch purpura is known as panda sign or raccoon's eye. Panda sign or raccoon's eye. Clear? Moving to the next spot. The next question, Binkley spot are known as. Binkley spots are known as. Binkley spots are known as. Anyone can tell me the answer? Very nice. Please remember, Binkley spot is nothing but diabetic dermopathy. Now please remember, all my students, what happens in a prolonged, long-standing, uncontrolled diabetes mellitus? What happens? The blood vessel wall get damaged. And when the blood vessel wall get damaged, the red blood cells, they start leaking out from the blood vessels. These RBCs will then go and get deposited themselves into the surface of the skin, the undersurface of the skin, mainly against a bony prominence. For example, on the shin. It can occur anywhere, mainly around the bony prominences. Now what happened? These red blood cells will then start inciting some inflammation at that local area, and in that inflammatory process the hemoglobin will then convert to hemosiderin, and that spots will start changing its color. Initially it will be red, then it will become green, blue, like that it will change its color. That is known as diabetic shin spot or diabetic dermopathy or Binkley spot. All these terminologies are known for same. Clear? Next. Which is the most common cutaneous manifestation seen in the patient with end-stage renal disease? Which is the most common cutaneous manifestation seen in the patient with end-stage renal disease? End-stage renal disease, which is the most common manifestation seen? The most common cutaneous manifestation seen in a patient with end-stage renal disease, please remember the answer is pruritus. Itching is the most common manifestation which is seen in the patient of end-stage renal disease. Okay. Please remember, all of them are the features of renal disease: pigmentation, half and half nail, pseudoporphyria, but among them the commonest is pruritus. Skin changes in a patient of hypothyroidism is characterized by all except. Tell me what is the answer. Please remember, in hypothyroidism, you will not see palmar erythema because it is a feature of hyperthyroidism. Rest all features like sign of Hartog. What is sign of Hartog? There is loss of lateral 1/3 of eyebrow. It's a feature of hypothyroidism. Orientus cutis, it is the yellowish discoloration of the skin. It is yellowish discoloration of the skin. And this is a feature of hypothyroidism because of deposition of beta carotene. Beta carotene. Dry coarse skin is also a feature of hypothyroidism, but palmar erythema, flushing, they are all the features of hyperthyroidism. Next question is on your computer screen. Next question is on computer screen. Anyone? Which of the following is the most common micronutrient deficiency found in the patient with eating disorders? Which of the following is the most common micronutrient deficiency found in a patient with eating disorder? Vitamin C, zinc, vitamin A, or vitamin B12? Please remember, in zinc deficiency or in eating disorders, for example, bulimia nervosa, anorexia nervosa, you see zinc deficiency. The most common micronutrient deficiency in the patient of eating disorders is zinc deficiency. Okay? Which of the following is not a causative factor for acne? Androgen, oily food, bacterial proliferation, bacterial cornification, proliferation, or hypercornification of the duct? What is the correct answer? Okay, so somebody is asking that why the beta carotene start getting deposited. Okay, so just for everybody's understanding, I think there was a doubt here. The students are asking why there is deposition of beta carotene in the skin in a patient of hypothyroidism. Please remember, all my students, what is beta carotene? Beta carotene is a precursor of vitamin A. It is also known as provitamin. Okay, now we need thyroxine for conversion of this provitamin A into vitamin A. We need thyroxine for that. Now imagine, in hypothyroidism this is missing. If this is missing, this conversion is prevented, and when the conversion is prevented, the amount of beta carotene increases, and this extra beta carotene will then start getting deposited into the skin. Understood this point? Who was asking that question? Rabia, I hope you have understood. Can you give me a quick thumbs up? if you have understood why orientus cutis is seen in a patient of hypothyroidism. Okay. Which of the following is not a causative factor? Please remember, oily food is not a causative factor. It's a very common myth. Like every time whenever the patient is accompanied by their parents, they're always worried that because the child is eating a lot of oily food and that is why he or she is developing acne. Please remember that is not true. There is no direct relation with eating of oily food and that of development of acne. Okay. There are food agents like milk products, or high glycemic index food that can increase acne by increasing the insulin-like growth factor and ultimately increasing the sebum release. But oily food as such does not cause increase in acne formation. I hope this point is clear to all my dear students. Okay, so with this we are done with the today's session. Thank you all of you. I hope you have enjoyed this 30-minute session. I want all of you to kindly start following all these classes. For any of the Unacademy subscription, you can use my code. This is here, Chesta10. Thank you everyone. Good day.